Hey all, it's Erika Hood from the Center for Reducing Health Disparities, and I'm here today with another one of our community spotlights. We have one of our partnering organizations here from Susan G. Komen, Northeast Ohio. We have Sean and Gina. Hello. Thank you so much. So I'll let you both introduce yourselves, talk about your roles at the center, and then we'll just learn more. So Sean, we'll start with you.
Okay, great. My name is Sean Shacklett. I'm the Executive Director of Susan G. Komen, Northeast Ohio. I've been with Komen for just about 7.5 years now. I've spent my career in health and human services. It's been an amazing journey with Komen, and it continues to be an adventure in these times for sure.
And what about you, Gina?
I'm Gina Chicotel. I am the Associate Director for Komen, Northeast Ohio. I have been with the organization for about 11 years now, so been around for a while, have a lot of historical institutional knowledge. I've served a variety of roles within the organization, but I'm mainly focused on our mission efforts, so anything that directly provides a benefit or a service to our community, I oversee all of that work. And also do a little bit with our marketing communications and some of our event planning stuff. But really my focus is on serving the community and making sure our resources are being utilized to the fullest extent.
Awesome, thank you. And Susan G. Komen, that's just a name that is just known in the community. I do want you all to talk about specifically the mission and the population that you serve within the organization.
Well, our mission formally is save lives by meeting the most critical needs in our communities and investing in breakthrough research to prevent and cure breast cancer. So it's a little bit of a mouthful. But I think the piece of our mission that I really like to focus on is the most critical needs. So we serve anyone and everyone in our community. So Northeast Ohio, that consists of 22 counties of Northeast Ohio. I don't know where I got 40 from. So we have a really large geographic area, but also very diverse. So we have some big urban areas in Cleveland, Akron, Youngstown, but we have some very rural areas in the southeastern part of our service area that, folks down there may have to drive an hour plus to get to a medical facility in order for treatment. So we've got a lot of different needs in our community, if you will. Although we're based here, closer to Cleveland and Akron, we are responsible for those communities. When we talk about critical needs, that encompasses a lot of different people, whether they be geographically isolated, whether they are uninsured, underinsured, low income. And so, we are really focusing on those folks with most critical needs. Anyone can come to us for help, obviously, but we really want to focus on those communities across Northeast Ohio that lack access to care and, are looking at disparities in healthcare. So, we've identified 5 priority communities in our service area that we see where the greatest need is and the greatest incidence of breast cancer, but we do serve all. But we do serve mostly and mainly those who are low income, uninsured, and underinsured.
Okay, thank you. That does help kind of explain more because I know the organization does a lot. And it looks to me as if we all are working remotely, if I'm guessing backgrounds correctly. So we know we had this huge shift in how we did our work in March. And how has that looked for the organization and your staff? How are things going?
It's tough. And I'll talk a little bit about the more practical side on how it's affecting the organization. And I'll let Gina talk a bit more about how, it's working with the patient side, right? And with services that we offer. Yes, we are working remotely. And in fact, because of just the challenges that COVID-19 has created, we're actually in the process of moving to working virtually from now on. So we are no longer going to have our office space, physical space, where we have had it. We're all going to be working from home, but we're instituting, systems in place so that it's seamless to anyone who needs help. So if they call our office number, they're still going to get connected to us in the same way that they do. We're just going to be working virtually online. Much of the work that we do in the community, we tend to work with people over the phone. We don't have direct services in-house per se.
Okay. So
a lot of stuff we do out in the community with partners. So we're able to deliver on that. So what we're able to do is reduce overhead so we can dedicate more dollars to mission. We realized we don't have to have an office space and we can still be effective in serving breast cancer patients across Northeast Ohio. And, COVID-19, fortunately and unfortunately, made us think about things differently and how we operate. So yeah, we will be moving virtually permanently, but we've got some great plans in place to be able to stay connected with folks. And we're seeing what the power of the continuing growing power of social media and connecting with people virtually can be. We will be back face to face when we can with people, obviously meeting things like that. But yeah, it's had a significant impact on both revenue and our operating overhead.
Mm-hmm. And what does that look like from the patient side? Those folks who need you during this critical time. COVID-19 is huge and is impacting us all. But if you have someone who is a new patient or has a new diagnosis and they just want support and they want to reach out, how has that looked, Gina?
We offer a variety of programs to our community members. We have some education seminars that we put on annually, and the COVID stay-at-home orders happened the day before we had our third annual metastatic conference scheduled. So we sort of saw the writing on the wall, thankfully, midweek of that week in March, and postponed the event until June. Okay. And then once April hit, we quickly realized in-person events were just not going to be a thing, probably for the rest of the year. And that seems how it's panning out. So we made a quick pivot to offering our programs in a virtual format, which many organizations have done. We've all made the switch. There's now something called Zoom fatigue because people are doing so many events online. And 2020 has certainly thrown a curveball at all of us. But we were able to successfully offer, in addition to our metastatic conference online, a series of online webinars strictly around COVID and breast cancer patients. So how to manage fear, stress, anxiety surrounding isolation under the stay-at-home orders. We had an Ask the Oncologist session where patients and survivors could ask an oncologist questions specifically related to their treatment and the COVID-19 and what would happen if they were diagnosed, because when COVID first hit, there was some information going around that they would begin to triage patients based on their likelihood of surviving the disease. And because breast cancer patients have underlying conditions and have been exposed to chemo and radiation, they were very, very afraid that if they caught COVID during one of the large spikes and hospitals were overloaded, they would not receive standard of care. And that question came up again and again at the beginning of the pandemic. So we were able to offer that session as sort of a way to ease some of those fears and concerns surrounding them getting COVID-19, in addition to just, should they suspend their treatments altogether, given the strain on the healthcare systems at that time. But they were all reassured to continue treatment. That is the best option for them. So we, of course, made the pivot to virtual events. And in January of 2020, we launched our in-house patient navigation program. So we now have a patient navigator on staff and opened that program up in January. And we were seeing some utilization of it, but then COVID hit and we had all of these great plans for the spring and summer to go out and do some on-the-ground grassroots community outreach to let people know about this program. And we definitely had to take a sharp left turn on all of those plans. So we recruited a group of volunteers who were able to locate healthcare system contact information for us. So we sent out our flyers electronically, sent info packets to all mammography centers, oncology centers, places like that, all the social workers within cancer centers. So they would have the information to be able to give to clients. And we're starting to see an increase of calls for assistance. We were actually very surprised that we didn't see much happening around calls for assistance when COVID first struck, because on April 1st, because our fiscal year is sort of wonky and runs April 1 to March 31st, on April 1st for this new fiscal year of ours, we launched our transportation assistance program. So under our patient navigator umbrella, we will provide up to 3 free rides per week per patient using either Uber Health or providing them with gas cards to get to and from appointments. Okay. We really could only get the word out about that program electronically. And a lot of our breast cancer patients are older individuals who may not access technology in the way that some of the younger survivors and patients do. They may not be comfortable with it. They may have shoddy Wi-Fi. They may not have a computer. They may not check their emails. So it's been a bit of a hurdle trying to get the word out about this program, at least to those we're trying to reach in the community. So in October, in supporting Breast Cancer Awareness Month, we're going to do sort of a guerrilla marketing campaign. So trying to get ads in all of the local newspapers, because we know through some community surveys that we've done in the past that for older individuals, they're still reading paper newspapers. That's how they get their information. So we're trying to do ads in there just to spread the word that we have these resources available for people. We also have been navigating women into screening itself. So pre-diagnosis, or hopefully before a diagnosis ever occurs, a lot of women now, because health systems have lifted the ban on preventive services, can now receive an annual screening mammogram. So women who are going in for mammograms still have to pay for them sometimes, especially if they're diagnostic tests or mammograms that come afterwards. So we have seen an increase in calls specifically for mammography, but not really for the patient assistance services that we provide. And those services run the gamut from, we can help you with insurance copays, medications, prescription bills. We can help with sexuality and intimacy issues surrounding a breast cancer diagnosis. We provide emotional and social service support to individuals diagnosed, as well as their family members and friends, because we know breast cancer really affects the individual, but it has a ripple effect with everyone connected to that individual. So we do offer support services to co-survivors and friends and family. But we just have not seen the utilization that we would like to see with this program. So we're really trying to get the word out that we have this service.
Okay. So, with some of my organizational spotlights, I'm really, I guess, surprised at how things have shifted and changed, or, there may be some concerns that they may not be able to reach their whole communities that they normally reach out to, and everyone mostly have found ways to make it work. And in your case, I think that, like Sean said, unfortunately, but fortunately, COVID kind of shined some light on shifts and changes that organizations can make for the better. And I think that this switch to, remote working, if you all are still connected, and then having those strong partnerships with organizations that can serve the patients, I think is huge. So that's exciting. That's all exciting. I guess the next question I have, so now that you all are at home and you're shifting the organization to work in this new format, what does the future look like? Any future programming that you're kind of working on? Some exciting things down in the future?
Obviously, I think there's going to be some structural changes from us moving forward as we kind of move into the next rest of this year and move into 2021. You got to make tough decisions, and you've got to watch cash flow. I mean, the practical side is you got to watch cash flow. You got to pay the bills, and you got to see what's a realistic expectation on operations. But then in light of that, I think we continue to try to be innovative. So Gina mentioned we brought the patient navigator on in the last year. That really started from a push to look at what our role is in the world of public health. So, Komen Northeast Ohio has been a very health specific organization, and we've been, connected to a large, event every year, what used to be the Race for the Cure and now is the More Than Pink Walk. And people knew that, and it was visible, and they knew that we raised money for research. They may or may not realize that we used to provide grants to organizations in the community to provide services to breast cancer patients. And now we're making this shift to provide more direct services directly to those patients. And, those decisions were made through the hard work of Gina and working with our board to talk about, what are some upstream effects that are, people have that influence the other outcomes with breast cancer treatment. And we started to see that it wasn't as simple as getting in, early, screening done. That's been our tagline for years. And it's, still very, very important, but it's not the only thing. And we've seen that there's so many barriers to care upstream from a breast cancer diagnosis that, we can at least try to begin to identify and create a way to address them. So, we've been looking at that, and the patient navigation piece was to try to address some of those needs, whether it be upstream, during treatment, or even after treatment. And I think, as we continue to evolve and try to be innovative, we're trying to look at needs right now in our community. And I think that it became very clear to us that there are specific needs for breast cancer patients from all walks of life that we need to be sensitive to and try to connect with our clinical partners around, because we feel that it's our role in playing, kind of having a presence in this public health space that we can kind of serve as a convener and work to address. And so we have worked on a new training program, and I love the way Gina kind of puts it all together, the way she describes it, because it continues to grow. We kind of started out with it being about this big, and we keep expanding it in terms of who we want to focus on and what needs are out there that we want to address and make a difference and an impact on. So I'll turn it over to her to kind of talk about the new training program that we're talking about. But again, it really stems from a decision we made a couple of years ago to try to take a more active role and direct service with our patients.
Okay.
Yeah, and to piggyback off of that before I start talking about the training, we did make the conscious decision about 2 years ago to really sort of suspend the grants that people know us for. A lot of our partners just thought of us as a foundation that cuts checks. That is all we do. We just provide funding for mammography and screening, which is one piece of what we do. So we really wanted to broaden that scope and bring direct services in-house and provide that patient navigation to not only address the breast cancer issues that people are facing, but to also address the social determinants of health. So our navigator can also help with housing, employment, education, applying for unemployment. COVID-19 has left a lot of people jobless. So they'll help with that stuff too. So we're really trying to change the perception of Komen, not only with our partners, but within the community itself, because a lot of people, even if they've supported us for years, didn't even know we gave out grants. So trying to get them to understand that we're now actually providing this direct service for them is going to be a shift in mindset for them as well. So we're really trying to change that narrative and conversation. And one of the ways that we're also doing that is through a provider training that we're hoping to launch in early 2021, focused on cultural bias and systemic racism in breast healthcare delivery. We believe this is a moment in time and in history that we have to capitalize on. And around, the statistics show Caucasian women are diagnosed with breast cancer at a higher rate, but Black women die more from breast cancer. So there is something happening from being diagnosed to treatment that is preventing African-American women and men from getting the care that they need that's quality and timely and accessible as compared to their Caucasian counterparts. So we've known these statistics for years, and we've done, some programs to try and address it, but we really feel like a lot of it comes from the systems down to the individual. So we're really trying to target healthcare providers, and we have a very broad definition of what a provider is. It's not just a person in a white coat who has an MD license. It's anyone an individual will come into contact with when they're entering a healthcare system for breast health services, from the scheduler to the person that greets them when they walk in the door, to the nurse that takes their vital signs and does the triage prior to the mammogram. So anyone who comes into contact with the patient, we really hope to try to address through a variety of sessions and topics, those populations that we feel are most impacted by systemic racism, inherent bias. So we will have one session hopefully dedicated to the social determinants of health and what inherent bias actually is, and provide some tools to assess that within the individual themselves, within the participant. And then have a session focused on the LGBTQ population, because they have very unique needs when it comes to breast healthcare specifically, especially for those women who have transitioned to men. So a lot of them don't understand that they still have breast tissue, they still have to get their screenings, and when they do go and get their screenings, they oftentimes experience discrimination that is unfound in any other group, with the pronouns and the medical history and appropriate names. And it's very important for providers to understand how their interactions affect a person's utilization of healthcare in the future, because one bad experience can prevent someone from going to care further on down the road and lead to more and more health issues, not just breast health. We also want to have a session that focuses on mistrust in healthcare systems within the African American community, with a specific focus on clinical trials and enrollment, because they are vastly underrepresented in clinical trials across the board, not just for breast cancer or cancer in general, but for all clinical trials. And then we also want to have a session focused on victims of sex trafficking and sex abuse, because they have stigma and stress and trauma related to sexuality and sexual organs. So they have also a different perspective that providers need to be understanding of when they're providing care. And then have a debriefing session afterwards so everyone can process the themes that they've heard about during these sessions, and come together and talk about any actionable steps they're going to take to improve care in the future. And we really hope within the entire training series to amplify the patient voice over everything else. So have people who have experienced discrimination or bias from healthcare settings tell their story and share how that affected them and how that impacted their health down the line. So we really want to humanize these issues for the providers. And we also want to provide actionable and easy resources that they can use not only to help themselves, but to help their patients along the way as well. So we're really trying to be as broad but as specific as we can, which kind of doesn't make sense. It's kind of an oxymoron, but trying to be broad yet specific. We will be sending out a survey for our providers to fill out, letting us know if these topics are important to them, but we really hope to launch this to the public in early 2021.
I think this is great. To me, I think it will also, I've heard from breast cancer survivors, just in conversations in this public health space, that Komen felt like an organization that may not have been for them, particularly Black women. So I think that this will help, looking at the different topics that you guys are diving into now. I think it would help to be more inclusive and say that this is an organization for you, and that you, it's whoever fits that mode, it's for all of you to feel that we are going to support you from whatever perspective you come from. So I think that that's great in doing that. What can some of our partners do to help with this? The launch is coming up pretty soon, but is there anything that you see could help or kind of make a bigger impact?
Well, we've already been in talks with a lot of our partners across the board. We've spoken with university hospitals, we've spoken with Metro Health, we have the LGBTQ Center on board, we've spoke with the Gathering Place, which is a therapeutic community for breast cancer patients in Cleveland. They're on board. We're working with CSU a little bit as well. So we are already trying to get our partners on board just to support this and to let their workers and providers know about the training so that they can sign up. And it will be offered for free.
That's awesome. All right, this is really, really good stuff. So is there something that you would like to say to the viewers, maybe even your staff? We're so used to walking around and seeing folks that we work with, colleagues. So Sean, is there something that you want to say to any of our listeners connected to the center or not about what the rest of the year may look like, a message of hope? We're always trying to hold on to some type of message of hope. This is a big one for you. Putting you on a spot here.
I love that because, I think in the days that we face now, it's just been a strange year. And I think the statement of hope, the idea of hope is one that we continue to just keep talking about in terms of, this shall pass and things will get better. It's just, it's going to be a hard grind. It's going to change significantly who a lot of organizations are in our community and what they do and who they serve and how they serve. And that includes us. And, I think first and foremost, I want everyone to know that we are still here. It may look different, it may be done differently, but we're still here and committed to fighting for you. And I think if nothing else, we are committed to continually innovate to address the needs in our community because, I think, and I'll speak for Gina here and I hope that this is okay, but I think for her and I, if nothing else, we've always been committed to trying to do things differently in an attempt to be more to the community than what we were perceived of before. And I think that, that's going to require us to take some risks and it's going to require us to be open to starts and stops and lessons learned. And I think that, that the most important piece is that we want to help those who need help the most. And we want them to feel like, when you said the statement is, we are here for you and that you is all inclusive. I can't express that enough. It's always been a bothersome thing for me. It's always bothered me that people thought, Komen's only for this group of people and that's who they serve. Definitely not, especially not Komen, Northeast Ohio. You know, we've tried to expand and include metastatic breast cancer patients and patients from all walks of life, no matter where they live or, you know, who they are. It's important for us to be able to reach out and support those, because ultimately, as Gina loves to say, cancer don't care.
Yep.
Doesn't care if rich, poor, African American, Caucasian, does not matter.
Yep.
Cancer doesn't care. It affects all. And so and I challenge anyone to say, I don't know anyone that hasn't had cancer, but you know, I'm still shocked at the number of people who know someone that's been touched by breast cancer, or you know, have a family member. So this affects our entire community. And although we are a piece of public health in terms of how we support people in the community, we will do our level best to support anyone, anytime, anywhere if they're dealing with a cancer diagnosis. So thanks for the opportunity to talk to everyone today. Really appreciate it.
No problem. I'm just grateful that you all were able to stop by for this podcast, and having worked alongside of you and in the midst of you, I missed kind of, I think, the time when at the center when you were at the core of the work. So doing things like this helps me, you know, get caught up and kind of grow closer. So I appreciate it so much. And we'll definitely get this up so other folks can see it. And I thank you guys so much.
All right, thank you.